Hi, my name's Phil Bowden. Professor and my fellow classmates, I am really going to enjoy this class with you. I wish you all the best of luck, and I'm just really looking forward to learning from all of you. Um, do I know somebody that's had problems or sickness? Um, I used to work in a group home, and I also worked in a facility that was a um, alternative to being in the hospital, mental health facility. So I met a lot of different people with mental health problems. Um, a lot of manic depression, bipolar, as they say nowadays. A lot of schizophrenia and some depression. Don't think anybody was ever in the places that I worked at for anxiety. um, One of the most common misperceptions, I think, is that I think one of the big ones is that people that are mentally ill are crazy. Just a word that I think we need to correct people on if we're talking to somebody and they use that word. The fact that there's the perception that the mentally ill um, cannot function on their own, that there's no intelligence behind that person. That was kind of some of the generalizations that I have run into in the past. Just to give you an example, as far as my opinion on that, in the group home that I ran, there was a man. Uh, his name was Bob Mull, as a matter of fact. I don't think he'd mind you knowing this. Bob was had a nervous breakdown, but prior to that, he did a one-man act of Hamlet, and he's just very talented. But then he had a nervous breakdown. Bob. So a lot of people would go to this center every day, and Bob was one of them. And Bob developed a comedy routine that he would do, and it just really everybody got a lot of joy out of it. And Bob lost his sight in both eyes and ended up in a nursing home. But in spite of that, and in spite of his mental illness and his nervous breakdown, Bob came out of the nursing home and did comedy skits. Like he did a skit in front of 500 people with Fred Travalena Jr. To raise money for mental health. He did this in front of 500 people, as I said. So he's just a tremendous guy, and I know a gentleman who writes for the Denver Daily News now, bipolar, and he's just a talented writer. I dated a girl for a while who is bipolar. She's raised three wonderful kids, managed two different houses that she's owned, and she's just very intelligent. And then there's the ICU nurse that I worked with. He's just very intelligent. He was able to take care of patients that were in critical care. Once in a while, his meds would get a little off sync, and he'd take a little time off, get that adjusted, and then he's back at work. And he also was very talented. So I tend to think that anybody that's bipolar, my personal opinion is that they're more often than not very intelligent, very smart, and certainly very capable. Probably, in my opinion, the most prevalent psych problem is manic depression or depression. Anxiety, I think, comes in close second, and oftentimes, of course, anxiety and depression are combined too. But probably manic depression, bipolar seems like the most common thing that I've heard of. I suppose if I had to name a few, I'd say bipolar, schizophrenia, and depression. Um, what about the role of the mental health clinician? I personally feel when I was a young man, a child, I acted out, and I ended up seeing a psychologist telling him about the little shapes and so on, the Rorschach test. And then later on, when I was in 17 or so, I saw a psychologist, what do you call it, vocational psychologist, who was just a great influence on me. And I've always had an interest in psychology ever since I met him. He would come and sit with me at the coffee shop, and we'd talk. It wasn't just a one-on-one clinician or clinic relationship. So the role, as I see it, of the mental health clinician was what this man did, is he listened. Primarily, he listened. Most people, when they come to you with problems, I believe that they're not necessarily asking you to fix it. What they are asking you to do is take the time to listen to them. So I believe that the main role for a mental health professional, mental health clinician, is just to take time to listen to the patient. Don't try and put your own preconceived ideas or preconceived solutions into the picture. Uh, the patient will give you an indication if they want you to talk. On the other hand, you can um, withhold advice or whatever, but most of the time I think patients just want you to listen, and you do, like I say, have to talk sometimes and kind of um, let them know that you're hearing them, but don't overdo it, in my opinion. Reason for taking this class? Well, I always love having psychology classes or openings to give you my testimony, because the reason I'm taking this class is, number one, like I say, I've always enjoyed psychology. Number two, I need this for my prerequisites for nursing. But number three is that I've been through what some of these people have gone through. When I was taking care of mental health people, I never thought that I would go through the pain and the misery that they were going through. However, back in late 2006, after laying around and just sometimes laying on a sleeping bag on the floor and just dealing with a lot of depression, I was going through my head. I was thinking about getting a gun. I figured, well, I had a 3-day waiting period, so I was figuring out how to work around that. I had visions of poking myself in the carotid artery, seeing that knowing as a healthcare professional that I'd probably bleed all over, and then I even envisioned myself putting a noose around my neck and jumping off my balcony. I can't tell you, if you haven't been through it, how much pain and misery this causes. So I admitted myself in 2006 to a psych unit. In 2007, I admitted myself 3 other times. And the point that I'm leading up to is that when you hear me talk in class, you'll find that I think that we should look for the medical reasons behind psychiatric problems and not just assume everybody's mentally ill. The reason I say that is because I felt my situation was medical, not mental. It turned out that it was caused by a medication I'd taken for 47 years, an anti-seizure medicine that in fact causes people to be depressed and has led to several suicides. And then it was also caused by sleep apnea. My oxygen was dropping at nighttime, and so once we treated the sleep apnea and treated got me off the medication, I was perfectly fine. It wasn't mental illness at all, but it was terrible, terrible, terrible. So I just want you to just hear my testimony, and this is a little bit longer than I had planned on. So I just want to tell you that during all of this and in past times, God has given me a scripture that I want to share with you. Please take your name and put it in front of this. It's Philippians 1:6, which says, in my case, Phil, being confident of this very thing, that he which hath begun a good work in you will perform it until the day of Jesus Christ. Thanks for taking the time to listen to this. I look forward to being in class with all of you. Thanks.